Okay, this is the MDC 3 final exam review. Describe the blood flow through the heart. Veins is towards the heart, arteries is away from the heart. Right is deoxygenated blood, left is oxygenated blood from the lungs. So inferior vena cava and superior vena cava to right atrium, through tricuspid to right ventricle, to the pulmonic valve, to pulmonary artery. The blood travels to lungs. It's branched to the left and right lungs to receive oxygen and carbon dioxide. Blood returns to heart via pulmonary vein, empties blood to left atrium, contracts mitral valve to left ventricle, ejecting to aortic valve to aorta to the body. Who was Frank Sterling and why do we care? He's a philosopher that discovered heart filled up at rest, the harder it will contract. Would you expect afterload to be increased by venous or arterial vasoconstriction? Resistance of ventricle vascular pressure greater than systemic pressure. Right ventricle must exceed pulmonary valve. Higher resistance leads to lower blood output. Calcium channel blockers. When, what, and signs of needing them. Slows the SA node and AV conduction. Avoid grapefruit juice. It's the first line for African American race. Beta blockers. When to need them. What name, signs and symptoms. Decrease in heart rate and cardiac output. Monitor for orthostatic hypotension. Adverse effect is depression. Congestive heart failure. Right and left. What class? Right is face, body, edema, fluid retention. This is liver, spleen, extremities. MI, distended jugular veins. Left, lungs, crackles in lungs, shortness of breath, enlargement of heart, regurgitation, blood-tinged sputum, orthopnea. Meds is diuretics. The first one to start is thiazide diuretics. The test is BNP. Peripheral artery disease, causes and how to sit if they have it. Symptoms include leg pain, cramping with activity. This is called claudication, weak peripheral pulses, and slow healing of wounds. There's 4 stages. Stage 1 is weak thready +1. Stage 2 is intermittent claudication. Stage 3 is pain when resting. Stage 4 is unhealed ulcers. ATP M2245, or apartment M2245. These are the locations to hear the valves. Mitral is the apex, which is the bottom, apical pulse. Cardiac tamponade, medical emergency, muffled heart sounds, pericardiocentesis, cardiomyopathy, infection control, diuretics, monitor heart rhythms. First signs of a rejected heart transplant is AFib or aflutter. Balloon angioplasty, it's in the artery, flattens the plaque. Educate patient to lay flat, keep still with a pressure band or a board to minimize movement for 3 to 4 hours. Bleeding is a problem. Slowly release the balloon if bleeding. Reinsert air. If there's a hematoma, you call the physician. CAD, different arrhythmias and meds. Chest pain is angina and shortness of breath. Angioplasty or bypass surgery to treat. Blood test is troponin levels. Meds are statins, nitro, and antiplatelet meds. Describe how to analyze an ECG rhythm strip. To estimate the ventricular rate, count the QRS complexes in a 6-second strip and then multiply that number by 10 to estimate the rate for 1 minute. List the causes and signs and symptoms of an ECG rhythm. So sinus bradycardia. This is PQRST waves are further apart. Signs and symptoms is fatigue, weakness. Give atropine. Tachycardia. PQRST waves are closer together. Signs and symptoms is dehydration and they're febrile, which means there's a fever. Give beta blockers. Atrial fibrillation. There's no P wave, irregular rhythm. The older population is common. Give blood thinners. In controlled AFib, give amiodarone. This is a rhythm drug. AFib RVR. There's non-distinctive P waves. It's fast and close together. Signs and symptoms is dizziness, numbness in hands and feet. Give calcium channel blockers like dalteplazam. Atrial flutter. This is a medical emergency. Sawtooth waves. Fast. SVT. Tachycardia without P waves and narrow QRS. Give adenosine with doctor in the room and code cart with pads hooked up, 6 milligrams. Then go to 12 if it doesn't work. Ventricular tachycardia. These are wide tombstones. If pulseless, start CPR and shock. Ventricular fibrillation. This is quivering. It's pulseless. Give CPR and shock. Ventricular asystole. Flatline. Not shockable. Give epi and bicarb if recently sick and CPR. What does the acronym MONA stand for? Morphine, oxygen, nitro, aspirin. Aspirin first, chew 2, then oxygen. Describe the differences between mitral and aortic regurgitation. Mitral caused by mitral valve prolapse, infective endocarditis, and MI. Progresses slowly, may be symptom-free. Aortic results from non-rheumatic conditions, disease of wear and tear. Right-sided heart failure can occur late in the disease. What is acute pericarditis most commonly associated with? Infected organisms, post-MI syndrome, Dressler's syndrome. What is infective endocarditis? Microbial infection of endocardium, often due to IV drug use. What are the key features seen? Pathogens, petechiae, anorexia, tired, heart failure, oscillar nodes, Janeway lesions, embolization, night sweats, and splinter hemorrhage. Pathogens. What is the most reliable criteria in diagnosing this? Positive blood cultures. List and describe the 3 factors of the Virchow triad: blood flow stasis, endothelial injury, and hypercoagulability. Atrial fibrillation, rapid, irregular, no discernible rhythm, heart rate. May be asymptomatic. Common symptoms: dyspnea, fatigue, palpitations, lightheadedness, weakness, chest pain, and hypotension. Can lead to clot formation, embolus, and then you die. Supraventricular tachycardia, abnormally fast heart rhythm due to inappropriate electrical activity in the upper portion of the heart, the AV node. Ventricles contract greater than 100 beats per minute. Treatment is calcium channel blockers, beta blockers, anticoagulants, catheter ablation, and Valsalva maneuver. Heart failure is diagnosed by an echocardiogram. Left-sided heart failure is restlessness, paroxysmal nocturnal dyspnea, elevated pulmonary capillary wedge pressure, tachycardia, fatigue, cyanosis. Right-sided heart failure is called cor pulmonale, fatigue, increased peripheral pressure, ascites, enlarged liver and spleen, weight gain, dependent edema. Okay, so left-sided, think drowning. Left side, lungs. Fluid is backing up into the lungs, which is pulmonary symptoms. Drowning is dyspnea, rales, orthopnea, weakness, nocturnal, paroxysmal dyspnea, increased heart rate, nagging cough, and gaining weight of 2 to 3 pounds a day. Right-sided, think swelling. Right is the rest of the body. Fluid is backing up into the venous system. Swelling, weight gain, edema, large neck veins, lethargy, irregular heart rate, nocturia, girth. This is ascites, hepatomegaly, and splenomegaly. High output heart failure results from an increased metabolic state in which cardiac output remains normal or above normal. Occurs when a condition causes the heart to work harder to meet the demands of the body. Signs and symptoms are elevated cardiac output, fatigue, shortness of breath, and fever or infections. Ventricular assist device is used to treat end-stage heart failure. Nursing education for heart failure. Take all medications as prescribed. Low sodium diet, fluid restriction. Atherosclerosis is plaque buildup that causes narrowing of the vessels and limits the blood supply to the heart. Risk factors include hyperlipidemia. LDL, you want low levels, less than 100. This is bad cholesterol. HDL, you want high levels, greater than 60. This is happy cholesterol. Angina. Angina pectoris is chest pain caused by an imbalance of coronary oxygen supply and demand. Stable angina results in ischemia and chest pain. However, the episodes are short and relieved by rest or nitroglycerin. Unstable angina is chest pain that occurs at rest or with minimal physical exertion. Variant or presmetal angina is chest pain that occurs due to coronary artery vasospasms at rest. The treatment for all of these is nitroglycerin, vasodilators, and decreases ischemia, which decreases pain, usually administered sublingual, and propranolol. These are beta blockers, decrease myocardial oxygen consumption, but these should not be given to patients with asthma, propranolol. Okay, so myocardial infarction. This is a complete blockage in one or more arteries of the heart. Plaque ruptures become a blood clot that blocks arteries in the heart. Signs and symptoms are shortness of breath, nausea, vomiting, sweating, pale and dusty skin, radiating pain in chest, jaw, back, and shoulder, ST elevations, and positive troponins. What does an MI look like in women? Neck, jaw, shoulder, upper back pain, shortness of breath, pain in one or both arms, nausea, vomiting, sweating, unusual fatigue, and heartburn. Valvular heart disease is caused by structural or functional abnormalities of the mitral and aortic valves. These abnormalities result in stenosis, regurgitation, and prolapse, which produce symptoms based on the disease process. Valvular heart disease leads to decreased cardiac output. People with Marfan's syndrome are at higher risk for mitral valve prolapse and aortic aneurysm. So Marfan's syndrome, the mnemonic is Marfan's. This is mitral valve prolapse, aortic aneurysm, retinal detachment, fibrillin gene abnormality, arachnoidactyl, pneumothoraces, and skeletal abnormality. Aortic stenosis is caused by the narrowing of the aortic valve that obstructs left ventricular flow, results in a backflow of blood into the left ventricle. If left untreated, right-sided heart failure can develop. Signs and symptoms are dyspnea, anginal pain, syncope with exertion, harsh systolic crescendo and decrescendo murmur. The treatment includes surgical valve replacement, and you need to monitor for bleeding postoperatively. If you have a valve replacement, lifelong warfarin therapy is required with frequent INR monitoring. Mitral valve stenosis is the narrowing of the mitral valve. The most common cause of mitral valve stenosis is rheumatic fever. This can result in right-sided heart failure. Heart sounds associated with mitral valve stenosis are rumbling and apical diastolic murmur. Mitral regurgitation is caused by fibrotic and calcification changes of the mitral valve that prevents the valve from closing completely. Left untreated mitral regurgitation can cause left-sided heart failure. The causes of mitral regurgitation is rheumatic fever, infective endocarditis, and papillary muscle dysfunction. Cardiomyopathy is a disease of the myocardium that impedes the pumping ability of the heart. Dilated cardiomyopathy is the most commonly seen cardiomyopathy. It involves extensive damage to the myofibrils and results in dilated ventricles that impairs systolic function. Signs and symptoms of dilated cardiomyopathy are fatigue, palpitations, chest pain, S3 and S4 gallop, weak peripheral pulses, tachycardia, and left ventricular dilation. Medications used for treatment of dilated cardiomyopathy are diuretics and digoxin. The common digoxin side effects are nausea and lack of appetite. Endocarditis is heart infections, inflammation that may affect the epicardium, myocardium, and/or endocardium. It may include infective endocarditis, Liebman-Sachs endocarditis, myocarditis, and rheumatic fever. People at risk include immunocompromised patients that are getting dental work done. This type of patient may need to take antibiotics prior to dental work. Pericarditis is an inflammation of the pericardium, the membranous sac that surrounds the heart. The damaged tissue becomes inflamed and creates friction when the heart contracts. A symptom associated with acute pericarditis would be a new ST elevation. This is due to local inflammatory changes in the epicardium underlying the inflamed pericardium. Pericardial effusion is the buildup of too much fluid in the double-layer pericardium. When this happens quickly or involves a large amount of fluid, the excess fluid can take up to too much space in the pericardium, compressing your heart and causing a life-threatening condition called cardiac tamponade. Untreated pericarditis can result in a pericardial effusion. Treatment of a pericardial effusion is pericardiocentesis. Peripheral artery disease is a disorder that of the vascular system in which the extremities do not receive adequate blood supply, resulting in leg pain while walking. The cause of the disorder is due to the buildup of fatty deposits in the arteries or atherosclerosis. Signs and symptoms include pain, pallor, pulselessness, which is decreased pulses, paresthesia, and paralysis. The medication treatment is antiplatelet drugs. Peripheral vascular disease encompasses several different conditions, including atherosclerosis of lower extremities, chronic venous insufficiency, and peripheral artery disease. In venous insufficiency, the valves in the veins do not work properly, which allows blood to backflow and causes pulling of the blood in the extremities. Now, there is plenty of blood and oxygen. Warm, reddish, thickened, leathery-looking skin. Symptoms include swelling, especially when the legs are in a dependent position, dull aching, heaviness or cramping in the legs, itching and tingling. If the limb is dependent, then gravity makes it more difficult for the blood to re-enter the body, causing increased discomfort. However, if the extremity is elevated, then the discomfort will be less. Ulcers, often called stasis ulcers, are most common ulcer of the lower extremity. Shallow, irregular, painful, often seen in a medial malleus discharge. Cardiac dysrhythmias. Why are dysrhythmias so dangerous? The heart does not adequately pump blood out of the heart during a dysrhythmia. This allows blood to pool in the heart. Pooled blood turns into clots. Clots break off and become emboli and cause PEs, MIs, and strokes. Then you die. If you are a post-op heart transplant patient with a dysrhythmia, what are you at risk for? Aortic aneurysm. Aneurysms are abnormal dilation of an artery in which the effective artery is dilated to at least 2 times its normal diameter. Aortic dissection is the most common complication and could be life-threatening if left untreated. A common symptom of an abdominal aortic aneurysm rupture is an abdominal distension. Why? The patient is bleeding into their abdomen. Anemia is the reduction in the number of red blood cells, the amount of hemoglobin or hematocrit. Some types of anemia are caused by decreased red blood cell production, increased red blood cell destruction, or chronic loss of red blood cells. Iron deficiency anemia is the most common type of anemia worldwide. Signs and symptoms are fatigue, weakness, irregular heart rate, shortness of breath, dizziness, headache, pale, cool skin is a symptom of severe anemia. Sickle cell anemia is a group of inherited red blood cells disorders in which the hemoglobin blood cells are hard and sticky and resemble a C shape. Sickle cell disease can result in chronic anemia, pain, organ damage, increased risk for infection, and death. Treatment options include immunizations to protect against infection, manage stress, prevent deoxygenation, promote oxygenation, administer blood products, and treat pain. Polycythemia vera is a chronic, slow-growing blood cancer disorder in which there is an increase in red blood cell production leading to leukocytosis, thrombocytosis, and elevated hemoglobin levels above normal. This uncontrolled growth results in abnormally viscous blood that impedes circulation and increases the risk of intravascular thrombosis formation. Anticoagulants are used to manage polycythemia as this reduces the risk of thrombus formation. Nursing education would include teaching patients to take their anticoagulant medication as prescribed. If they don't take their medication, they can form clots, which can turn into an emboli, and then you die. Thrombocytopenia is low platelets. Platelets help clot blood. If you have low platelets, you are at risk for bleeding. If you have a patient that is at risk for bleeding, they should be on fall precautions. Fall precautions equal bleeding, which equals death. Heparin-induced thrombocytopenia. Signs and symptoms include petechiae on hands and feet and low platelets. Symptoms appear after treatment with unfractionated heparin. Is the patient a fall risk? Yes. Autoimmune thrombocytopenic purpura is also called idiopathic thrombocytopenic purpura. This condition results in a decrease in the number of circulating platelets. Antibodies are produced and coat the surface of the platelets, making the platelets non-functional, resulting in clotting impairments. Causes of autoimmune thrombocytopenic purpura is viral infection and autoimmune disorders. Common symptoms is a reddish, purple, fine petechial rash. Hemophilia is an incurable hereditary bleeding disorder characterized by prolonged bleeding times. Hemophilia A results from deficiency of factor VIII and is most common type of hemophilia. The common symptoms is joint pain and bruising. Hemophilia B results from a deficiency in factor IX and is less common. Common symptoms is spontaneous bleeding, GI-GU tract bleeding. Causes of hemophilia is genetic. The lab result is prolonged activated partial thromboplastin time. Transfusion reaction. Care of the patient during transfusion includes monitoring of the vital signs 15 minutes after the start of the transfusion and post-transfusion. Monitor the patient for signs and symptoms of transfusion reaction, such as chills, shortness of breath, hives, itching, back pain, and changes in vitals. If the patient is experiencing a transfusion reaction, immediately discontinue the transfusion, flush the IV line, and notify the physician. Blood products must be returned to the lab for analysis. Transfusion reactions typically occur within the first 50 milliliters of the infusion. Leukemia is a blood cancer that results from a loss of cellular regulation, leading to an overproduction of immature white blood cells, also known as blast cells, in the bone marrow. Due to the increased production of immature cells, the bone marrow is unable to produce normal blood cells. Treatment includes stem cell transplant. For patients with leukemia are at risk for infection, strict hand hygiene is necessary to prevent infections. Signs and symptoms are bleeding gums, bone pain, and bruising. Chimeric antigen receptor T-cell therapy is used to treat non-Hodgkin's lymphoma. Possible CAR T-cell therapy side effects is high fever and chills, trouble breathing, severe nausea, dizzy, headaches, fast heartbeat, and pancytopenia is a deficiency of all three cellular components of blood: red blood cells, white blood cells, and platelets. Do you need an INR and PTTs drawn if you are on enoxaparin? No. Shortness of breath and atrial fibrillation in the 180 causes would include hypotension and low oxygen. Newly diagnosis of sickle cell, best response from the nurse is tell me more. Assessment in hemophilia A would include joint pain and bruising. T-cell therapy for non-Hodgkin's lymphoma. Client has petechiae and bleeding. This is pancytopenia. Walking decreases pain in legs. No hair. Thready, weakened pulse. Signs and symptoms of what? Legs should be positioned. They should be hanging down. Petechiae on both hands and feet after heparin. This is HITT, heparin-induced thrombocytopenia. Platelet count is low. What should the nurse do? Initiate fall precautions and bleeding precautions. Signs and symptoms of myocardial infarction. Pain radiates down jaw, shoulder, back, abdomen, diaphoresis, ST elevation, and positive troponin. Polycythemia vera, dangerous signs, shortness of breath. New diagnosis of leukemia, teaching, strict hand hygiene, to prevent infection. Adverse reaction to nitroglycerin is orthostatic hypotension. Advise the patient to lay down, monitor blood pressure, and maintain airway. Post-operative heart surgery, a nurse assesses for bleeding. Aortic stenosis signs and symptoms, dyspnea, angina pain, syncope, and harsh systolic murmur. Atherosclerosis is suspected with lab values of low HDL and high LDL. Peripheral arterial disease signs and symptoms, +1 pedal pulse. Polycythemia vera, family education. Take anticoagulants as prescribed. Teaching hypertension to a patient. Adhere to sodium restriction diet. Signs and symptoms of leukemia, bruising, bleeding gums, bone pain. Adverse effects of digoxin, nausea and no appetite. Chest pain, palpitations, fatigue, S3 and S4 gallop, weak pulses, tachycardia, left ventricular dilation. This is dilated cardiomyopathy. Treatment for supraventricular tachycardia, or SVT, Valsalva maneuver. Hemophilia lab test, prolonged activated partial thrombin time, and APTT. Signs and symptoms of elevated cardiac output, fatigue, shortness of breath, high fever caused by septicemia. Right-sided heart failure is associated with hepatomegaly and edema in the peripherals. Post-operative heart transplant. What is the priority action and post-operative stage? Dysrhythmias, such as VFib. Teaching for congestive heart failure, fluid restriction, low sodium diet, medication, daily weights, report symptoms to provider. What food is high in iron? Green leafy vegetables. Teaching for warfarin. This is a lifelong therapy and frequent INR testing. Propranolol adverse reactions. You cannot take these with bronchial asthma medications. Blood gas values for end-stage kidney disease, metabolic acidosis. Infective endocarditis signs and symptoms, night sweats, fever, malaise, newly developed cardiac murmur. The most accurate way to monitor fluid gain or loss is daily weights. Neutropenia patient with confusion most likely has a UTI. Signs and symptoms of venous insufficiency is edema, brown pigmentation, achy legs that resolve with elevation. Signs and symptoms of severe anemia. Severe anemia, cool skin and pale. Pulmonary edema, first action for the nurse, administer oxygen. Mitral regurgitation, left untreated, leads to what? Heart failure. First dose of blood pressure meds, signs and symptoms to watch for, hypotension, and help assist the patient out of bed to the bathroom. Teaching for enoxaparin, notify your healthcare provider if your stools appear tarry. Pericarditis can turn into what if left untreated? Cardiac tamponade. Valvular heart disease causes what? Decreased cardiac output. Thrombocytopenia care. Avoid IM injections and put ice on bumps or bruises. Women with myocardial infarction may present with atypical signs and symptoms. Assessment findings for pericarditis is elevated ST. Aneurysm, rupture signs and symptoms, distended abdomen. Mitral valve stenosis sounds like a rumble. The best tool for diagnosing congestive heart failure and seeing ejection fraction is an echocardiogram. Assess for chest pain when receiving blood. Dilated cardiomyopathy is treated with diuretics, vasodilating agent, and cardiac glycosides such as digoxin for contractility. Atherosclerosis risk factors is sedentary lifestyle and limited exercise. Treatment for infective endocarditis is antimicrobials. Treatment for sickle cell disease is blood product. Administer cardiac medications at what rate? You give the medication slow. Autoimmune thrombocytopenia purpura assessment findings is petechiae, reddish and purple. End-stage heart failure treatment is ventricular assisted device, or VAD. Possible treatment for leukemia is stem cell transplant. Medications used for heart failure is diuretics, digoxin, and ACE inhibitors. Meds used for peripheral arterial disease, or PAD, is antiplatelet drugs. Sickle cell interventions is warm environment, increased fluid intake, and morphine for pain management. Pericardial effusions are treated by pericardiocentesis and watch for infection. What predisposes a client to mitral valve prolapse? Marfan syndrome. Unresponsive without a pulse. You do CPR. Reaction to blood. What do? Stop the blood transfusion. Protruding veins in the legs are what? Varicose veins. Client receiving treatment for hemophilia. What is the most appropriate to review in the assessment? Joint pain and bruising. Treatment for non-Hodgkin's cancer. Chimeric antigen receptor therapy, which is CAR T-cell therapy. Nursing care for non-Hodgkin's lymphoma cancer with petechiae and bleeding. What side effect of this therapy is associated with the therapy? Pancytopenia. Client treated for DVT and was developed post-op heparin treatment and now has petechiae on the hands and feet. What drug reaction? HIT, which is heparin-induced thrombocytopenia. Patient has low platelets. What do we want them to know? Implement fall precautions. Patient with unstable angina has an 8 out of 10 chest pain and non-relieved by rest. He has a 12 lead and 2 liters per an IV placed. What's next? Give nitro. Mona, morphine, oxygen, nitroglycerin, and aspirin. The priority is oxygen, nitro, aspirin, morphine. Client with radiating chest pain. What is the nurse's indicating of an MI? Jaw, back, shoulder, abdomen pain, sweating, ST elevation, positive troponin levels. Patient has aortic valve replacement and is now on CV ICU. What is the priority? Assess for bleeding. Elderly patient is in the ED with shortness of breath and angina pain and syncope. What type of valve problem is this associated with? Aortic stenosis. Atherosclerosis. Which of the following is considered a risk factor? Low HDL. Client diagnosed with peripheral artery disease. What's the common finding? 1+ pedal pulses. Patient is recently diagnosed with leukemia. What signs and symptoms is consistent with leukemia? Bruising, bleeding gums, bone pain. Patient comes to ED with fatigue, palpitations, and chest pain. Assessment findings show S3 and S4 gallop, weak peripheral pulses, and X-ray left ventricle is enlarged. What disorder is this? Dilated cardiomyopathy. Heart rate is 220 beats a minute. Cardiac monitor shows tachycardia. What is it? SVT. Have them hold their breath and bear down and put face in ice water. Hemophilia patient lab test to confirm. What would it be? Prolong activated patriarchal thromboplastin time. Right-sided heart failure. What is associated? Hepatomegaly. Post-op heart transplant patient. What is the nurse's priority? Monitor for dysrhythmias. Doing discharge teaching for heart failure client. What should be included in the teaching? Medications, low sodium diet, fluid restriction, and symptoms to report. Patient with iron deficiency and planning a diet for high iron foods, leafy green vegetables. Older patient with dental work done a few weeks ago now has malaise fever and night sweats and a murmur. What's going on? Infective endocarditis. Patient is unresponsive. What do? Start chest compressions. Edema, ascites, and distended veins. What is the best way to monitor fluid gain? Daily weight on the same scale. Magnesium, 1.7 to 2.2. Potassium, 3.5 to 5. Sodium, 135 to 145. Calcium, 9 to 11. Diagnostic ejection fraction test is an echocardiogram. What clients would not be good candidate for thrombolytic therapy? Hemorrhagic stroke a month ago. Dilated cardiomyopathy. What is the best farm treatments? Diuretics and digoxin. Risk factor for atherosclerosis. Sedentary lifestyle with limited exercise. Patient with infective endocarditis. What is the priority treatment? Antimicrobials. Treatment options for sickle cell patient. Blood products. Most common assessment finding in patients with autoimmune thrombocytopenic purpura, reddish and purplish rash. Patient with end-stage heart failure, what's your treatment? Surgical treatment with ventricular assistive device. Heart failure, you give ACE inhibitors, digoxin, and diuretics. Possible treatment for leukemia patients, stem cell transplant. Patient with a transfusion reaction, stop the transfusion. Peripheral artery disease, the medication of choice, antiplatelet drugs. Patient with sickle cell, what other interventions should you do? Give morphine, increase fluids, and warm environment. Patient with peripheral effusion, what procedure do you anticipate? Pericardiocentesis. Genetic condition, what predisposes patient to mitral valve prolapse? Marfan syndrome. Patient assessing on admission, distended neck veins, and edema to ankles. What is the diagnosis? Varicose veins. Clinical manifestation of mitral valve stenosis, apical murmur, rumbling, apical diagnostic, diastolic murmur. Women with MI have abnormal signs and symptoms. Patient with thrombocytopenia, are they experiencing pain and you have to give meds? Where should you give it? Question if they wanted to administer IM. Do it IV. What patient is the priority? Severe facial and oral swelling after a facial fracture. A STEMI is an ST elevation myocardial infarction. The treatment is cath lab with stents. They need to open the vessel up immediately. Patient must be on heparin to prevent further clotting. Stent is placed and the plaque is pushed back up to the sides of the vessel. Atherosclerosis is plaque formation on arterial walls. Arteriosclerosis is thickening or hardening of arterial wall associated with aging. There are 4 stages of peripheral artery disease. Stage 1 is asymptomatic. Stage 2 is claudication. Stage 3 is rest pain. And stage 4 is gangrene and necrosis. An aneurysm is the dilation of an artery as much as 2 times the natural diameter. Forms when middle layer of artery is weakened, producing stretching effect on inner and outer layers. Rupture is most frequent complication and is life-threatening because abrupt and massive hemorrhagic shock occurs. AAA. Thrombus is a blood clot believed to result from endothelial injury, venous stasis, or hypercoagulability. Thrombophlebitis is thrombus associated with inflammation, like a DVT. Cardiac dysrhythmias. So diastole is relax and filling of atria and ventricle. Systole is contraction and emptying of atria and ventricle. Depolarization is the response of cells to impulse and excitability. Repolarization is restoration and recharge of cells. The SA node functions on the exchange of sodium and potassium ions. It controls the right and left atrial contraction. If these electrolytes are off balance, it risks dysrhythmia. When the AV node depolarizes through the ventricles, it gets ventricular contraction. When the AV node depolarizes, the SA node repolarizes. For sinus brady, the drugs is calcium channel blockers, atropine, a bolus of IV fluid to replace volume, and oxygen. If the beta blocker overdose, give glucagon to increase heart rate and blood pressure. AFib, there's no clear P wave and no atrial contraction. Signs and symptoms is irregular apical pulse, weakness, dyspnea, shortness of breath, decreased blood pressure. If the patient has been in AFib less than 48 hours, you can shock them. Treatment is rate control, embolus prevention, cardioaversion, anticoagulant, and prevent heart failure, increase cardiac output. VTAC. The causes is heart disease, myocardial infarction, hypokalemia, hypomagnesemia, drug toxicity, and cocaine. There's no perfusion, no pause to allow for diastole, and no pulse. You can shock as first intervention. The treatment is cardiovert. VFib is no pulse, no perfusion, ventricles just kind of shake. The most common rhythm seen following a huge myocardial infarction. Shock and give CPR. Ventricular asystole. There's no electrical impulse in ventricles and no ventricle depolarization. No QRS, no contraction, no cardiac output, no perfusion. Treat with CPR and find and treat the cause. It's hardest to come back from. Blood types. A positive. You can give it to A positive and AB positive. And you can receive A positive and negative A, and O positive and negative O. O positive, you can give it to O positive, A positive, B positive, and AB positive. You can receive from O positive and O negative. B positive, you can give to B positive and AB positive, and you can receive from B positive, B negative, O positive, O negative. AB positive, you can give to AB positive, but you can receive it from everyone. A negative, you can give to A positive and negative, and you can also give it to AB positive and negative, but you can receive it only from A negative and O negative. O negative, you can give to everyone, but you can only receive from O negative. B negative, you can give to B positive and negative, and AB positive and negative, but you can only receive it from B negative and O negative. AB negative, you can give to AB positive and negative, but you can only receive it from AB negative, A negative, B negative, and O negative.